Everybody knows that this is the #1 way to kill germs, and it's very, very important that we do that. And it's not only important for the providers to wash their hands, it's important for care partners. Nobody should ever touch your loved one without washing their hands, and that includes us. And so sometimes the doctor will come in and you don't know if they've washed their hands, or maybe they hadn't, because some of them aren't real faithful about that. And so you'll want to ask them.
You really do?
It's one thing to ask a 3-year-old, you know, little Billy, did you wash your hands? And it's a whole other thing to ask your sister or something, Joan, did you wash your hands? But to ask the doctor or the nurse is something you absolutely have to do. Remember the MRSA and the C. diff and the superbugs. We have to do that. Especially when the doctors come in for their rounds, make sure that their lab coat is closed. I read this a study about the amount of germs on neckties. Because the doctor walks in and the lab coat's open, they're going to look at your patient, and then so they're taking their hand, which may or may not be washed, and they're holding their necktie in, and you're thinking about those 23 other people and what's wrong with them up and down the hall, and it can be very scary. So it is perfectly okay to say, will you please wash your hand before you touch my hand? Now, I've diffused it with humor sometimes. You know, I've said, you know, Doc, we were just having this conversation, or we were holding on to a CampaignZERO checklist here, and it says that washing hands is the #1 way to prevent infection. Watch that, doctor. So if over there to wash their hands, they'll do it. So power suggestion is very good there. If you get any pushback, you can escalate that. If a doctor gives you pushback, you can escalate that to the medical director. If you get pushback from a nurse, you can ask that your nurse be reassigned to